He said, well, somebody told me you are a very big eccentric. But I feel at least 60 to 70% of the current workload of hospitals and medical professionals can be substituted.
And I'll be very honest that nobody can play God.
Some people are actually believing ChatGPT more than.
Hello guys, today we had a I'm very fortunate to work with two of the most brilliant mind of this country, and we are also very lucky to be actively working with them for last 1 month. Although they do not require introduction, I'll give a quick introduction. So this is Dr. Paul. He's MD of Mazumdar Shaw, Narayana Health City. But that's not only it. He has like 5 decades of experience in medical field, and he has also done a lot of work not only for like affluent class but all over the diaspora of Indian society. And this is Dr. Shetty. He is head of CMF department in Mazumdar Shaw Institute, and he also has more than 2 decades of experience. For people who do not know what CMF is, CMF deals with this part, like cranio-maxillofacial surgery.
Yeah.
It specifically deals with the
neck
jaw
and
part
skull.
and skull part. You have to think that this is one part of body which is like very obvious and very like front. So
This is all cranio-facial.
this is our actual human skull, and
You can see.
These are modern stuff.
These are the ones with which we 3-dimensional one which we use to design our surgeries.
yeah. So this is like very high impact on everyone's life. It changes the quality of life of people. So thank you for joining us.
Pleasure.
And we'll start by the most influential or biggest thing which I can see is this this specific building. So if I believe Dr. Devi and Ms. Mazumdar Shaw called you to build a small cancer institute, but what this is like is way beyond what initial imagination was. I would like to know how this came into and what is the whole thing.
Yeah, it is actually a mystery to me why they selected, because when Kiran Mazumdar, Devi Shetty already had done significant development bringing down the cost of cardiac surgery. See, earlier cardiac surgery was considered inaccessible to the poor man for the simple reason it was very expensive, and he had radically changed the whole thing. And Kiran Mazumdar was actually revolutionizing biotechnology in India. And as a woman, she had come the hard way and created a most inspirational structure. And what interested me most was Dr. Devi Shetty's passion. When I came here and when they were actually describing, he said, I have done something in cardiac, we have brought down the cost. But cancer is the other problem. If everybody lives longer and longer, cancer will be much more. And we have to do this. And he told me there is something that needed to be done. I have asked him afterwards why he selected me, because I did not have experience building a whole hospital. He said, well, somebody told me you are a very big eccentric. I do not know whether it was a compliment or something, but the truth of the matter is I have tried to actually bring in, I realized that anything that is new and revolutionary requires a structure which is new and open to development in ways that probably has never been done before. And that's the great lesson I learned from these two people. And that was the beginning of Mazumdar Shaw Medical Center. So I came, and Kiran Mazumdar even in those days showed me, while all the big companies were going for only generics and just developing large market, when she was already investing heavily into research. And that inspired me, because the future of healthcare is not just taking things from the pharmaceutical industry, but healthcare, the doctors should be actively involved in finding out problems and solving it through pharmaceutical industry, and also actually involving newer technology. So hospital becomes an epicenter for innovation, and hospital becomes a place where the innovations first take root and not in the mind of an engineer and a business person, and become a translational value. That way, if you can do that, you see, you can actually provide a solution to the poorest and also a solution to the greatest. I think that was the great vision that actually challenged me here. And as you can see, we have built this one. It is an effort of everybody, and I can only tell you that if you are in the shadow of Dr. Devi Shetty and Kiran Mazumdar, it is impossible for you to fail. Yeah, thank you. That's it.
So there are two things which are very interesting. First of all, you said that the innovation take roots in hospital. That is very new for our generation. So whenever we hear the tech penetration of it, we always hear that construction and healthcare are two sectors which are like least bothered about tech.
Mm-hmm.
So this is very, very new and novel approach to this thing. Sir, we already talked earlier. You had a very different definition of health. We would like to know that.
Now, see, I came to a conclusion. Usually the definition for anything, if you consider health, people know when we are getting ill. So people have, it is binary definition. The health is an absence of illness. Then where do you put the aging? In some people's mind, aging itself is some sort of an illness, and the way people sometimes treat the elderly, one would think that it is, but it is a process. And acute disorders like infection, it had a phase. That time it created revolution. When penicillin was discovered, I mean, it revolutionized. Now we are dealing with chronic disorders, where that is probably the first killing problem that we find. But chronic disorders are very much not just a medical problem, they are also a social problem and also an engineering problem. They cannot be, because they have a long trajectory of development. So I realized that we had to actually develop a concept of health which is amenable for understanding in metric terms. That means it is measurable health. So far, identification of disease and its progression was the way medicine worked. So I said that the way we have to understand it, we have to actually understand health and find out how far along the health pathway towards disease somebody has progressed. Because many of the diseases cannot be actually, you don't have a disease. Does that mean that you do not have nascent disease? You already have some sort of a disease probably progressing, all of us, either because of your genetic predisposition, because of environment. So how do you define? So I actually defined it, I think I'll have to look at the computer, but I defined it as health is the sustained coherence of interacting physiological networks within adaptive regulatory bounds, preserving resilience and the capacity to restore stable biological function. What it means is very simple. Multiple systems in our body are interacting. And when you are very young, you have so much of reserve capacity that even though you might have a progression of disease, you are able to cope with it. You might have some degree of heart disorder, but because you are young, you are able to cope with it. And while this physiological harmony begins to disintegrate as we become older, or is the amount of derangement within your system becomes more and more disruptive, then you come to this. That means health is a state in which you actually have a problem, but is it a reversible problem or it is a consistently progressive problem? And is it measurable? So as soon as I made this definition, it required a completely a new mode in which you have to imagine health and measure it. So we moved from molecular and basic diagnostic to a completely an engineering terminology of health, between a genomic identification of how your genetic makeup is and the condition in which you are either aging or you are getting a chronic disease, diabetes or whatever, even brain degeneration. So that is the new definition of health.
And sir, you work a lot with infants, small
Yeah.
children. How do this definition fits there? Like how this progression thing?
Well, in my line of work, there is definitely a role for interception because a large volume of the cases that we do is children born with early deformities of the skull. This happens because there is premature fusion of the skull. So there are sutures in the skull that allow the brain to grow and the skull grows with it. So what happens is when these sutures fuse prematurely, one is it prevents the brain from growing further. So that causes significant brain degeneration and underdevelopment. And they also subsequently develop other symptoms like loss of vision, improper cognitive development. And this can not just happen in the skull, but it can happen in the facial sutures also. So it creates a lot of facial asymmetry, which becomes very hard to treat as the child grows old. And the amount of brain damage that's already caused cannot be reversed. So in a way, you can intercept this by treating these patients early, and you can release these sutures and allow the brain to grow normal. So this is one area where I do see some role for interception. But we are also looking at other ways to also predict using AI how these the facial growth patterns happen over time, and you can intercept the growth disturbances with small little engineered devices like springs and screws that will allow the skeleton to still grow, and you can avoid these deformities from developing.
So what I understand is like you guys are having a paradigm shift in medical field where you are shifting away from thresholds to a continuous monitoring, for a long time. Even with the case of skull, you have a continuous monitoring of a long time. Dr. Paul, you have a very interesting patent in this, like how evolution of different parameters can lead to a much better and holistic result for a patient.
Yeah, this actually happened. I started becoming interested in artificial intelligence and developed the patent for synthetic cognition and intuitive artificial intelligence because of a very simple observation. During COVID, the time I came to the conclusion that in the ICUs, all these patients are in ICU, we have 25 or 30 different parameters that becomes accessible to a doctor. Then the doctor is able to spend not too long time with the patient. Now later on you will find that certain parameters are going. For instance, you might be developing temperature, or your hemoglobin might be dropping, or your oxygen saturation, but whatever the factors are there. Now we will take action and we'll actually select 1, 2, 3, 4, 5 ways in which we are doing based upon the thresholds we have reached. But I noticed that whenever the threshold change, when you have 30 parameters, other parameters are also changing, but they are not getting recognition because our focus is only on the ones which significantly change. That means, in terms of complexity theory, if you really consider, if you have certain things which are changing and correspondingly there is also a shift that are taking place which are not yet coming to the threshold, are they meaningless? There must be more than one pathway by which the threshold shifts are taking place. Now, they are not getting recognition unless the doctor is an extremely experienced doctor who makes sense of the whole. They will actually interpret it by looking at the patient and some other parameters. Then I asked myself, if you were to mathematically construct a way in which translating why different thresholds arrive in different people in different ways at different sequences, and actually work out the continuum, then you actually have an understanding of actually the changes in physiology of this particular person. For that, I created a method by which people can be analyzed and how data can be converted into large constructs. Because I realized there are two ways in which you can look at the data. One is by dividing it into small bits and pieces. But if you did it, you actually miss out many things, because what you're fragmentalizing data in very complex adaptive systems, really the adaptation proceeds in different ways. And you will miss out if you are actually looking at small segments. Same thing with waves of the sea or with, I'm sure, even in the larger impacts of gravitation, in whatever situation. So there had to be a system by which the whole is captured, the totality is captured, the phenomena is captured, and the components of it that actually constitute it is then identified, and so you actually go to a completely a different way in which you look at the data. So that's what I created, and that has become the basis in which we work. So we work with unlabeled data.
Yeah, that's very interesting to know. So doctors have limitations, you mean to say. So for example, you have all the data, and what a doctor usually would do is that he would look at all the reports, and then according to the thresholds he would say, okay, this is how a person's life is going, and how his health is, in which trajectory it's going. But the overall picture of the patient cannot be seen just by a single human doctor, you could say.
Not like that.
Okay.
Actually, doctors, human beings have limitations.
Yes.
And, no ability in terms of data science itself is a limitation. Anything that you perceive as knowledge automatically has reduced the quantum into a understandable term. So the whole process is there. And a fellow called, very, very famous doctor called Gawande at Harvard, I think, he actually made a checklist manifesto. He said, to simplify this problem, there should be a checklist. So 1, 2, 3, 4, 5 you actually do if you fulfill it. Now it is possible. You can actually look at checklist manifesto, but it actually deprives the benefit of understanding the subtle ways in which complex systems like the human body transforms itself, and what differentiates one from the other, and personalizing a treatment or an approach that will actually work best. So what really happens with human beings is you work within your adaptive capacity. Okay, why? In aged people, a person might be 80, 83 years old. He will be treated and he will be doing everything. But one major health episode will completely disrupt that particular person, and next thing he knows, he's not coming out of it. Why? It is because he actually, to start with, he was healthy but with very low adaptive capacity. That's why I changed the definition of it. So in these people, you cannot just go by a checklist. If you went with the checklist and treated them for the outliers, you actually miss the whole concept of treating them. So many of these elderly succumb to the disorder. Once you put them in the ICU, they are not able to recover because they cannot cope with the medications, and the therapeutics itself becomes a problem. So doctors do have great limitations by virtue of the nature of the complex being we are dealing with.
So for the audience who missed the big ideas, first idea is that the temporal part of it. So rather than having one snapshot of a time and seeing that okay, all the parameters are correct, doctor has made an evolution of it. So it might be a vector which can go in other space. Another thing is because now systems are evaluating it for a specific person, you can evaluate multiple parameters. So it's basically high dimension. Earlier you might just see blood pressure, this is one dimension. But because of it, now you can also see hemoglobin level, SO2 level, etc. So dimensionality of the data also increased.
Yeah.
And another thing which Dr. Paul introduced is adaptability. So a person is not sick on one specific day. His body is a complex system and keeps on adapting until something fails horribly.
Yeah.
That's basically current threshold science. So this is what a paradigm shift is, that rather than threshold sign, if we can identify if the adaptation already started, so you can intercept it earlier. Now sir, I'll get back to this part itself, that there is you have talked a lot about interception, like knowability before predictability, that kind of interception. How do you think like this will happen on ground? Like we had a fortune of being in one of the biggest hospital, Narayana itself, for a month, and we have seen that a lot of research happened on the research paper, and there are many state-of-the-art models, but we see a very less penetration on ground. So I would like to have your opinion on that.
Yeah. See, although the medical science has tremendously advanced, the practice of medicine even today remains very ancient. There is a slight difference to that. And I think the radical shift that will take place is in the practice of medicine. How do we apply our minds? How do we deal with it? Although the investigations and modalities and all the things that work together, see, each investigation and all the data that we have very often still is only fraction of the data that really needs to be understood to understand a complex physiology. And theories of disease, again, if you really consider, what is the theory of diabetes, for instance, or degenerative brain disorder? If you really, we have explanations about why things have, but we do not understand the causality with clarity. You understand that is the difference. It's an engineering concept. I'll tell a simple example. We do know what apportions the quantum of insulin that gets into the system and which brings down the blood sugar is titrated by the liver by always combining the release of glucose with a quantum of insulin. You follow? That means when actually the islets of Langerhans, they produce the insulin, they also produce glucagon because they are all in sequence. And this actually is introduced into a liver, where the liver actually, because of the action of the glucagon, releases glucose, along with it insulin. So, all these systems do not work on unilateral shift in controlling, like the way we are doing. What we do is we do aggressive reduction in one parameter or the other. You understand? While it does not happen, it actually is a modulated response that really works in the body. Now that actually changes though the dynamics in which we understand. That's why it is very, very difficult for people to arrive at it unless we start translating physiology and also anatomy into engineering mathematical terms and look upon the whole process, not purely where the adaptation and all the other parameters work, but everything actually has a measurable metric. This might not be a molecular change. That means the molecular changes will be providing signs and symptoms of change. There will be other ways in which the overall shift in the body's functionality can be tracked. That is one of the great areas of interest to me.
Sir, do we see similar pattern in CMF also, that you require some like measurable things and you also measure? And what is the difference between current state of the art research and what you see on ground?
So the practice
and
has...
Just to add one more question,
Yeah.
What is a blockage? Like, why don't we see research translating very fast to ground?
So definitely it's evolved over the years that I have seen. I've been in this area for 16 years of active practice and before that training. So from where we started to now, we've come a long way. There's a lot more automation in terms of technology. There are better ways to record and plan things, new materials. It's made our surgery very accurate, very predictable, and there's a lot of simulation that can be done now that we couldn't do many years ago. So that's something that people want to see, right? When you have a surgery, how will I look after that, or what you're going to do? So we're able to show it in multiple layers. There is penetration in terms of augmented reality, and a lot of things are coming up. But fundamentally, I think we need to still work on changing the things like interception. So those areas are still unaddressed, and we need to
chronic disorders.
Chronic disorders.
Yeah, chronic disorders. So these areas, somebody has to look at it. And returning to your other question of why there is not enough penetration of the technology that we developed through research. Like Sir said, most people, at least in India, the practice is still very old school, and still they believe that when feeling is feeling is believing, sort of. So the acceptance is a little, they're resistant to accepting newer technology and methods. So it'll take time, but I feel we've still come a long way.
So a question for let's say a person who has come in with who requires a facial surgery, because you see nowadays face is mostly everything.
Yeah.
As you go to someone, you talk to someone.
Yeah.
So what are some of your experiences? I just want to know, when you do a surgery on someone and after that you basically fix them. So what are the outcomes, or how do the patients feel?
So there are two categories of patients.
Okay.
Like you see on social media also, there's a group that has a very unrealistic expectation about how they look, what they should do, and in life in general.
Yeah.
So that's one group of
The
patients.
Instagram people.
Yeah. So with them there is no winning, and
Okay.
but they're a good source of, you can continuously keep working on them.
Yeah.
But you will never completely satisfy them. There will always be that very small 1 millimeter difference between the left and right, which they're always cribbing about. So that won't change. The other group are people who are genuinely requiring some help. And they're very real groups, and they say, just do this for me, and this will help me go out and get a job, or it'll help me in the social situation at school. So these are the patients that you really feel for. And I'll be very honest that nobody can play God. You can't create something which only God can create, or you can't even fix it for that matter. So there are many instances where you feel that you can do, but you know that it's humanly not possible. But you wish that. So from a doctor's side, very often we have that situation that I wish I could do a little more for this person, but you know that that's where my limitation is. So like I said, there are two groups. I'd rather spend more time on the second group.
Yeah. The first.
And I'll go out of my way for the second group. First group is
more towards cosmetic surgeries and
unrealistic. That's the problem.
unrealistic.
Cosmetic is still fine, but
If
unrealistic.
somebody has a gross deformity or ugly, it is easier to repair. But somebody is already okay, and then they ask for small refinement. The further you go, the more difficult it becomes, and less they are satisfied.
Yeah.
Sir, since you brought up social media, I'll ask this question. There are a lot of, we have seen a shift in how even doctors behave after COVID. So many doctors from many renowned places have started hiring brand agencies to put social media content on their site, and they also keep on posting and try to get that social media influence. What are your thoughts on it?
Unfortunately, that is a reality. I'm not very good at it, but I'm nevertheless not forced to do it. I try to do some, but I'm not good at it.
This is one occasion you are doing it.
Yeah, it seems like. But this is how far I go. But yes, a lot of people do it. Some people are genuinely good, and I think it helps people to reach out to people who are good and doing good work. But again, the consumer is not always able to differentiate between who's really doing something good and who's not. So there's a risk there. But it's not just doctors. I think hospitals, everybody is going out into social media to get themselves noticed. That's how it works currently, and that's where people go to look there for information. So earlier it used to be Google, now it's more on social media.
Now it's ChatGPT.
But actually, some people are actually believing ChatGPT more than I know one very distinguished, very intelligent person. Anything you say, he said, no, I've already checked it, and ChatGPT told me to take this medication. And what can you say? What you are able to understand about yourself and put in ChatGPT also has limitation. You see, many times these people are not able to really put the questions in such a way that ChatGPT able to, so they get incomplete answers. But as Dr. Samarth pointed out, see, if people are only looking at media, and media itself is so, I would say, biased, the way it actually, essentially it creates a bias. To get truth is very difficult. I think today it's very, in fact, we are unfortunately very bad at this. So usually the patients we get are people who desperately need us. You understand? But I think it creates a lot of deception. I am not happy with the way, I don't think doctors should, it is. You know, your greatest testimony should come from the work that you do and how that. See, Dr. Shetty, everybody knows, because truth fact is, he treats patients with great compassion. If you go and see him in the outpatient service, he really spends time with patients. Number one. Number two, I know he is an extremely good surgeon who has a tremendous. So whether he himself operates or not, that's not the question. It is a question, he has enormous experience and a commitment to helping the poor and the commitment to helping the people. That translates into great capability. But if you are there just to get there, do this thing, give patients, you are actually using the media to sort of hook people in, while your competence really does not justify that level of ability.
So you're talking about ChatGPT and smart people. Like we had a discussion where we see a trend that a lot of smart tech people are losing jobs because of wave of AI, like a lot of unemployment by huge tech companies. And you had an amazing idea about repurposing them for greater things like agriculture, medication, like healthcare.
You were telling about a new type of hospital.
We did some experiments here. I mean, I did. My student Samarth earlier, and when Dr. Biju, who is no longer with us here, we actually thought that really, if you want to really make an impact in the life, particularly poor people, you can't make medicine an additional burden on them, because they are already struggling with agriculture and whatnot.
Yeah.
You understand? And they can't even spare the time to go to see a doctor unless they are desperately ill. But then we asked ourselves, if we actually became the overall, that means you do not need doctors. If you actually bypass the need for doctors, medical professionals, but we actually equip people to become very important members of this society, contributing in agriculture, contributing with my finance, and they actually multiple. So my dream is that, as people come out of these IT companies and so on and so forth, engineers, they're all intelligent people. You have intelligence with humanity also, real compassion. Then it is possible for us to train them in multiple levels. And AI will become the next tool, because they do not need to really go, understand that much. We can actually create ways in which we can provide expertise and experience without them having to go through the entire process, because we have. And we can actually, I really believe, as Vinod Khosla said, we can get it to such a level that really we will be able to empower and democratize healthcare. That way, I think we will solve the problem of universal healthcare. Otherwise, it cannot be. If we just depended on doctors and highly trained people to do it. But there is a very specific niche area that only doctors can perform. But that can never be replaced. But I feel at least 60 to 70% of the current workload of hospitals and medical professionals can be substituted by this new model, where they become all-purpose, multi-purpose societal empowerers and healthcare workers. That's my dream.
60 to 70% is huge, because in India, doctor to patient ratio is very low compared to HOW standards. So
I think if to our team, I'm sure, let me ask you, you're all engineers and very smart people. Don't you think if we are given a a district and told, this is the amount of, we have only one small hospital, you actually transform it into a place where everybody here actually gets health care. Don't you think it is possible?
It is possible.
I think it's possible under guidance of a very visionary leader. But yeah, I agree on that point. So just to drive the point home, Dr. Paul is saying that it is possible to give a very good healthcare to everyone without even a person having a medical degree. So this is such a revolutionary thing if you think about it. Anyone who has the ability to reason, ability to think in a structured manner can become a healthcare provider with the tools, with like AI tools, with predictive tools, with other kind of tools. And another one of like very revolutionary idea he proposed is that rather than making healthcare like you have to go out of your way to get healthcare and come back, combine it with current social thing. Like sir has already done an experiment where he has combined agriculture thing and healthcare. So when a farmer goes, he for like buying grain, fertilizer, his blood pressure and everything is measured and he's incentivized on it. Think about it. How will this revolutionize the whole rural healthcare landscape? And another good thing is that intercepting medicine. Now think if you are going for regular checkup, you can also intercept it way before the problem becomes critical. And because you have married it with social thing, people are more often to show.
Yeah.
And sir, I would really love to go in a little detail on your imagination of this specific hospital. How would it look? What technologies you are going to use? How the experience of a patient would be when he just enters the hospital?
Yeah. In fact, there will be two settings I'm thinking of. If it are in cities, really I'm thinking that it should be inserted into, there are a number of ways in which we can actually categorize the people. Now currently, if you go into the airport, there are cameras already actually working out and profiling you in very significant ways. So it is possible today with modern technology, even in these particular hospitals, even when the person comes through, even his gait, the way he walks, very often nowadays doctors have no time to see how the study of a human being, even just from the facial expression, you can make out how much the person is in pain, in suffering. Very often, by the time, do you know how much time it takes for a doctor? I think I look up at the hospital of the future is that AI will enable people who are in anguish, who are in suffering, who are aged, to be prioritized automatically. This is what I am planning to do in Udupi when I create this hospital. Really. The AI will do it, and AI will actually allocate people, number one. Number two, it will quickly do a demographic survey and actually align each particular patient to a health worker. I told you he's not a doctor. He's one of those people who are best psychologically attuned to work with these people. You understand? So that they do not feel completely, it is not everybody can treat everybody. Some people are more comfortable with somebody. Somebody might actually be more comfortable with a older person. Somebody might be more comfortable with a younger person. And as the case may be. So the first process of this one will be there. Second one, we will actually introduce investigations. Our primary work that is taking place in our enterprise is to convert ordinary investigative modalities like ECG, EEG, or even laboratory investigation tools into very powerful tools for data acquisition. That's a different science altogether, but we are able to do it because these things will be. So essentially the health worker will be able to get a very high level of predictive capability and also profiling. Now, what we are doing is that in this particular hospitals, every person who comes through, his basic health metric has already been profiled. That's what, as you know, you saw how we can, even in terms of quantum computing, we are already able to create a very, very definitive profile. So we are able to actually understand how far he is improving, how far he is going down, and what are the changes that are taking place automatically. Then whoever requires help will be taken to the next level. It will be at the level of a primary care doctor. But with the empowerment with AI today, an ordinary MBBS primary care doctor who is empowered by this one will be able to provide a level of care today specialists are able to provide. Then what happens? Again, it brings down the value. Then if they actually really need a specialist, we can even do telemedicine, we can actually get the thing. And we can even get the world's best people to actually look at them. And then they actually go for the procedures where, in fact, it's a complete revolution in terms of architecture and how do we actually deploy and how do we make it a very compassionate service. I hope that answers your question.
Sir, it answers my question.
All aspects.
Yeah, all aspects of it. I would like to go to a very different topic. It's just one ending question. How a person of your caliber, your responsibility, is able to first find time and then enjoy art, music, literature, and then cooking. And same goes for you. I've seen your pictures, like photographic picture, and there your name written and everything.
Yeah.
How do you guys find time, and how has it affected your career and how you think?
It is the way I look at it. If you want to be effective in life, you should be able to have a level of contentment. You might not have great happiness or whatever it is. Life is not about excitement. But you should be able to do things, because not many things that we are forced to do in our careers you love. Our everyday patients come to see suffering and anguish. That's one thing. You can handle it, but it requires a certain expenditure of your innate. So to me, investing seriously into the love of literature, poetry, music, not I am saying that just randomly listening to it, but getting to a point where that it speaks to you, that can regenerate you, it can fill your back. It is not a background noise, but it is the spiritual force which actually helps you to drive you. That completely transforms. To me, I think every morning, in fact, my only request with Dr. Samarth is that he should give me a very good cup of coffee and listen to a little bit of Bach or Beethoven or something like that. Not for any reason. There is a certain way this great eternal music and art and your ability to paint also enriches your life, so that even when afterwards, if you have things which will sap your energy for one reason or the other, and if you face failures, still you can actually go back into your little corner and find the joys of solitude and be inspired. That's why I find a great deal of happiness in what I do. Isn't it?
I don't know what I obviously I don't have the same kind of spontaneity that he has. So for a lot of things, for me, it doesn't come naturally. So like you play violin quite easily, that's genius. But I have to really make an effort to learn. But I'm interested, and a few things like art, I think I have a little bit of I can do art. And I love watching, especially this impressionist art. I just love seeing this painting. So whenever I'm traveling, I like to go to museums and see. That's art, music. So I think everything happens simultaneously. As such, even the person who's doing nothing has no time, if you ask him. So somehow you have to push yourself and get things on the go, and whatever you like it, you pick it up and take it forward.
I think it would be nice if you actually recited a poem to end this
I asked you to.
so that we are all inspired.
In next
episode.
Next episode, I'll start with a poem. Yeah, I would like to end this. First of all, I would like to thank both of you for giving us time and opportunity for coming and speaking you, and also we are I'm personally very grateful for broadening our even view of life, how do we view things. And Dr. Samarth, I personally shadowed you in your department for couple of days. That was a very different experience. By the way, for audience, I first witnessed a surgery in his department, and I'm not good with blood, so that was something interesting. And I've also seen people very grateful to both of you, and I am personally very grateful. I would like to thank Yashvardhan and Samantha for giving us camera and microphone. Thank you, and thank you guys.
Thank you.
Thank you very much. Thank you.
Thank you.